Hi, everyone. I want to share with you what I recorded and did a webinar yesterday for dental health professionals throughout Canada. It was for the company called Invisalign, and they wanted to have me share with other professionals across the country how I look at the use of Invisalign in my practice so that we can create minimally invasive dentistry. And I know that when I do lectures for other groups who may not have dental knowledge, they still get a lot out of it. And so I always think it's wonderful for you to be able to have the time in your own space to be able to look at this and just think about what the possibilities may be for you or for others. And even if there is no possibilities for you in the sense of you don't need it, hopefully you'll still gain a lot of insight to future possibilities and prevention primarily for yourself, so that maybe we will never have to do this work for you, or you can share with others. So I hope you enjoy. The presentation will be a little bit over an hour, and if you have any questions, please, feel free to ask us, email us at the office, and at the end, I offer my ebook to you if you would like to use it as a guide. I just want to keep you healthy and well until 120, or at least till 100, but definitely for sure in good health, and that our teeth will give us the service that we need and feel good about our smiles. So this is what I shared on May 7th, 2020 during COVID, and I hope you enjoy. So this is where you come to visit me. It's the 3-floor dental office in Midtown Toronto, Yonge and Davisville. I'm always happy to have people come to visit, professionals, and always new patients, because I believe that my existing patients are always well served, and they don't need me as much anymore. So I learn and I grow and I develop. I enjoy having new visitors come to our practice. The focus today is going to be about oral health as a part of overall wellness. Malocclusion if left untreated, treatment planning for form and function, and beyond the patient's aesthetic concerns. I graduated in 1977, and in 1980, I wanted to find a way to not give a mandibular block that would last for 4 hours to my patients for simple filling on the back molar of the bottom teeth. So I chose to take a course in acupuncture that opened many doors that allowed me to embrace a holistic point of view for my own lifestyle and within my practice. My training over the past 43 years has been extensive, 4 to 6 weeks a year, which includes being a graduate of Pankey Institute, studying neuromuscular occlusion, and now I mentor at the Coy Center in Seattle. That's 2 other dentists. So learning occlusion with Dr. John Coys, I realized how I could optimize the best foundation for my clients by the application of aligners. I realized how many people can benefit from Invisalign treatment. And when I was doing the seminar, I reflected and I realized that over 100% of my immediate family actually benefited because I gave them Invisalign to wear. I personally did 3 sets over different times as Invisalign got better, and I realized what I could do to help myself in my own learning. My husband has had it and my 2 children have had it, and they have had it post their traditional orthodontics that I only knew of braces in the past because I knew I could do better for them. 90% of my close friends have undergone Invisalign treatment because of their belief and understanding of its benefits. 90% of my employees or teammates also ask for Invisalign that have been with me in my practice for over 10 years. And I strongly urge and demonstrate to 80+% of my clients that Invisalign could be of benefit to them if they choose. So why do I embrace Invisalign? Well, Invisalign are clear aligners, and it's about form and function, much more than an aesthetic smile. The bonus is that a beautiful smile occurs when we create healthy form and function, because it allows for easier oral hygiene, better occlusal surfaces, better alignment of teeth, and often less stress on the TMJ. It is a more relaxed smile, creating better facial aesthetics and often better posture results. And I tell my patients that they will have more money in their pockets long-term with fewer implants, root canals, crowns, and extractions, with the benefit of a beautiful smile to help them navigate their way through life. So why I choose Invisalign as a healthcare provider? Well, clinically it allows me to create minimally invasive dentistry. It sets up my cases to be less invasive by conserving more tooth structure. It increases my patients' awareness and importance of good and accessible hygiene care and tooth longevity. It often eliminates pressure on our TMJ, which is here. Expansion opens our airway and often allows people to breathe through their nose rather than being a mouth breather. It optimizes function and structural integrity. There's less wear on our tooth structure over time, and it's helpful for ages 8+ years and older. So holistic includes not only our physical or emotional or mental and spiritual health, but the whole is more than merely the sum of its parts. So when I was looking at talking about what is holistic, I decided I would do, hi Siri, what is the definition of holistic? And Siri responded to me this way. It was characterized by the belief that the parts of something are intimately interconnected and explicable only by reference to the whole. Characterized by the treatment of the whole person, taking into account mental and social factors rather than just the symptoms of a disease. I love this photo or this picture because it shares this view rather than this view, and what are the advantages. So if you took healthcare practitioners, or any of us really, if we happen to wear a white coat, as in this picture, and we blindfolded ourselves, we would be positioned at a point on the elephant. And then you'd say, well, what do you see? And each one of these people really came up with a very valid description of what they thought it would be. However, when we took off the blindfold and everyone saw the full picture, they would agree that it was truly an elephant. So during this COVID time, this was posted on the Facebook, and the picture is inside a hydrangea. And I just think that it is such a beautiful, I see it as so beautiful. And it describes to me that really there is so much more than what we see. Whoops, my phone is talking to me. Sorry about that. I think it activated Siri. So when I look at this hydrangea, what I see is that there's a lot of beauty inside as well as outside. And I know from this point forward, whenever I look at a hydrangea, I'll always see it differently. So why do I even talk about Invisalign for young children of 8 years and up and teenagers? Well, it has so many benefits from a holistic point of view. There's less metal sensitivity concerns because we don't work with metal. Fewer visits and emergencies, very responsive changes, little discomfort, and better hygiene. A lot of parents say to me, oh, I don't know that my child will be responsible for this. But I have so many people say to me, like, my kid is great at this, and the children like it. Originally, sometimes they think it's cool to wear the metal braces, but I describe to them, metal braces is really like a landline. You know, you're tied to a short place, and there's a lot of inability. You don't have the freedom. Whereas with the Invisalign retainers, you get to change them every week. They're not smelly. You have better hygiene. You don't have to see us as often. You won't have urgencies and emergencies. And the technology is so brilliant. It's almost like having a cell phone rather than a landline. And the movement is slow in the sense that it is very calculated, and it allows us not to be able to go on a straight path for you rather than opening up a construction site and then juggling everything around. And every time you change your aligners, unlike having a dental visit where you have a wire change, you will have a lot less discomfort, very little discomfort. And you just put them in at night, and when you wake up in the morning, they're usually great to go. Oh, I'm sorry, I reversed that. So we're going to go forward. So adults project into the future for their children. I mean, that's what we've been taught, right? Like, and that's what we've experienced. So we do want our children to have the very best, but do we as adults project into our own future? So what if we were to share a future occlusion, which means a bite, that many of us may experience when we are 90 plus years, with ourselves as being either Generation X and baby boomer patients? What would our future look like? And what will our teeth look like then? So let's look into the future. And I want to share my story about my parents and dementia. So this was a picture of my parents. At the time, they were 96 and 92, my father being 96. And they lived with me for 3 years because my mother had dementia and my father couldn't look after her because he was legally blind. Over the 3 years that my parents lived with me, my father did develop dementia. And then my mother had a small infection in her leg that we thought was going to be easily treated by IV antibiotics at Sunnybrook Hospital. But it turned out that one day it just took a turn for the worse. Her mind and body weren't connecting, and she ended up being in critical care. She did survive through that, so she was placed in palliative care at Sunnybrook Hospital. And my dad, being so connected to my mom for 72 years, he chose to go to the Veterans Center at Sunnybrook, where he could see my mother on a daily basis, and they could have concerts, share concerts together, because Sunnybrook has a wonderful program there. So it worked for both of them. And I'm not sure if you've had patients and parents in the 90s or experience looking after people in their 90s, but their life is very fragile, and symptoms come on very quickly. And it's hard sometimes for people with dementia to share it with us. And the care that both my parents received was phenomenal. So this is a picture of my father's teeth when he was 90 years old. And this one tooth looks very dark and like, oh my goodness, what is that? But that was a tooth that had a root canal when he was 12 years of age, and it never had any problem. His dentist put on a crown, and therefore the gum receded, and that's why it looked so bad. But you never saw it when my father smiled, because he had a very low lip line, and so you just saw the kind of the edges of the front teeth. But you can see that the teeth were chipped, and the bottom teeth were kind of worn, and he has what's called a very deep bite. It's like this rather than like this. And the gum line at the bottom kind of goes up and then down. And the reason why is because those teeth have gotten worn, 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 and then they just kind of erupted up higher, moved up higher. So this is what his teeth look like, which at this point, I don't want any of my patients to ever get to this stage. And then when he got to be 97, they got really, really small. And they were very kind of melted almost away a little bit. They became a lot of erosion. And then one day I looked at him, and believe it or not, as a dentist, when I see people, I always look at their teeth first. I always look at their smiles. So when my father was living with me, and I saw him one day, and this is what I saw. And I said, oh my goodness, how did this happen? It just seemed that it happened overnight. I was like shocked. And the wear on these teeth was so drastic that I knew they were going to wear down faster. And I was very concerned that the nerve was going to be exposed. And because the tooth usually has a way to compensate for wear, that the nerve kind of shrinks away and we get a protective layer. But this was happening way too fast at the top. And then it could abscess, and then it could become an infection, and that could take his life out. And at this point, my father was not cooperative with me in the chair. If I'd say, I have to fix something for you. His last visit prior to this said, no, I don't need it. I'm fine. And there was just no cooperation. So what was I going to do? It was so hard for me to acknowledge and accept that maybe this could be something that could cause him to have his life end earlier than perhaps something else in his body. And if I had known 20 years ago what I know today with the advancement of science, education, and technology, I would have been treating him very differently than I did previous. So this was an X-ray which showed there was lots of bone, and the teeth were healthy underneath, but in another few years, it wouldn't have been like that. So today we have technology where we can do a digital scan, and you may have had this experience in our office because I want all of my patients to be scanned. I don't charge for this. I just want to have this data because it tells me how the teeth are being worn. I can do time lapse and we can see what's going on. And it's a way for me to show you with a digital format exactly what's going on in your individual mouth so we can track or we can make choice of change. But you can see all this red. I don't want any red in any of my patients' teeth, and especially on those front teeth because they just don't have the strength. They're not meant to chew food. They're just meant to bite into food. When you think about biting into food, it's like this. It's not like this. So therefore, these teeth should never be touching. But for my father, every time, it would have been touching and rubbing that caused that problem. So let's talk a little bit about dementia because we never know what our future is going to be. Certainly, I had no idea that, in 20 years' time, my parents were going to be in this situation. And it's becoming more and more common. So if it isn't this, it will be something else for us. But I do believe we have the opportunity of minimizing any risk in our mouth for our future longevity. And that's what I want for you and for all of my patients and for everyone, because we know we can do better. So this statistic shows that 937,000 is the number of Canadians who will be living with this disease in 15 years. And 1.1 million is the number of Canadians already directly or indirectly affected by this disease. And the cost is $10.4 billion annual to Canadians to care for those living with dementia. That's huge. The Telegraph reports that gum disease may play a pivotal role in the development of Alzheimer's disease, scientists believe. According to the article, researchers said that they now had solid evidence that the bacteria which causes periodontitis produces an enzyme which destroys neurons, leading to memory loss. The article says that the bacteria Porphyromonas gingivalis, which we short form for P. gingivalis, is one of the chief causes of gum disease and tooth loss in humans. And an international team of researchers tested the brains of 53 people with Alzheimer's, finding the bacteria enzyme is present in 96%. So can you imagine that people with Alzheimer's and dementia, one kind of dementias within the category of Alzheimer's, in the lesions in their brain have bacteria from the mouth. So I have been researching, mouth-body connection for years, but I always used to think about mouth going downward, like gravity, and into the bloodstream, into the heart, the lungs, the pancreas, throughout our body. But I just really never thought about the bacteria going up to the blood-brain barrier. And that's what we're finding now. So every 65 seconds, someone in the United States is diagnosed with Alzheimer's disease, which is the most common form of dementia. It is the 6th leading cause of death and a profound human tragedy. 71 million baby boomers are heading for the risk age, and this may become the biggest epidemic in medical history. Dementia is not inevitable, and scientists agree the cure very well may be in prevention. Every day, dental providers use an arsenal of assessment protocols that directly coincide with modifiable Alzheimer's risk factors. An innovative way to help in the prevention of Alzheimer's disease is to utilize valuable oral health care providers who can be instrumental in reaching the public in ways other healthcare providers may fail. So it's very important to have education for me, my team, and for my clients. You need to level foundations so that we have very little wear on our teeth and loss of teeth, and also to have sustainability. So this is a picture or a representation of what my mother's teeth would have looked like, but this was not her mouth. But what has a commonality is that where you see the star is where she had a tooth out of alignment. And it never bothered her. I never thought about fixing it with metal braces because I never thought that she'd have Alzheimer's. I didn't realize bacteria would go to the brain. She could always keep it clean. She wasn't a grinder clencher like my dad. And I really just never thought that we would have to do anything about that. But when she got sick, she was on oxygen and pureed foods for 4 months. And this was all we could really do to clean her teeth. The healthcare providers would do it. And if you know anything about people with dementia, they're not overly compliant all the time. And so how were we ever to clean her teeth with this kind of aid? And then as she got older, she was given real food to eat from the hospital. So the healthcare providers would give her the main course, and then they would give her the cookie or dessert they would supply. And you know that the cookie dessert has sugar in it. And by that time, the coffee was pretty well cold. So she may have drank part of the coffee in the beginning, but probably at the end, there wasn't very much, nor an impetus to want to have the coffee afterwards to try to wash out all those sugars. So guess what happened? A lot of sugars and lots of bacteria in the mouth would create the acid that would sting the tooth, that would cause decay. But if I had known 20 years ago what I know today, I would have treated her differently, just like I would have treated my father. I would have brought that tooth into alignment, as you can see from the stars, without extraction, but just expansion. And then she could have had those teeth in better alignment and less chance of maybe having decay that I wasn't able to even be able to deal with being in the hospital and having the problems that she had. So not only was it about the sugars, but as she got, she was in the hospital, and even before with the dementia, she would often sleep with her mouth open. And you know, when you sleep with your mouth open and you breathe through your mouth rather than the nose, you end up waking up and your mouth is very dry. Well, this can be a problem, because what does a dry mouth feel like? It's parched, it's dry, and it's rough. Now, just as teeth are like a fish out of water when you do have a dry mouth, because they do not survive without saliva, just like the fish doesn't survive without water. So the teeth become a little bit more brittle, and it's not a good scenario. Now, it goes further, because this dry mouth isn't just for people like my parents. It's also for over 17% of people suffer with dry mouth over the age of 65. And even more people suffer with dry mouth who happen to have our mouth breathing from a high palate. And this can be at any age, 5, 6 years and up, whether or not they snore or have blocked sinus, whether or not they get radiation from oral cancer. If they have autoimmune diseases, a lot of times this dry mouth is a byproduct of this disease symptom, and also from a lot of medications will also create dry mouth. So it's hard for us to keep our mouth clean, and the saliva doesn't wash away the bacteria as much, and we get a bigger accumulation causing gum disease and more prone to decay. So I often start off my lectures with this picture of Mona Lisa. And you know, Mona Lisa was painted, of course, by Leonardo da Vinci, because he is the most famous painting. This is the most famous painting in the early 1500s. I mean, I did research on Mona. I found out that the average age expectancy was 43.6 years for women and 48.7 years for men. Now, I often ask this question: why was Mona not showing her teeth and smiling the way we smile today? And I'm going to give you the choices. A is because she's shy. B, because she has a secret. Or C, because her teeth were were yellow, crowded, and pyorrhea had set in at that point in time, where it was smelly and kind of dirty looking teeth. And it was really known in those days. D would be that it was considered vulgar and rude to open your mouth in public, to be able to show your teeth. Or E, is it all of the above? So I would probably say it was E, all of the above, because if we can't open our mouth and smile to people, how do we really communicate? How do we really share our insides? And to always keep our mouth closed, it's like we can't fully be present. So could her teeth and the people of her generation have been silent killers, as I was so worried about my parents? So my goal is to create a healthy and functional smile, and an aesthetic or beautiful smile will be the byproduct. So let's look at what happens to teeth over time. The top teeth are very beautiful teeth, very pristine. The middle teeth, they tend to wear over time. Not only do they get darker, but the edges get worn down, and we actually see the enamel wear away and the dentin gets exposed. And then over time, once the dentin gets exposed, it becomes very exponential. And you can see these graphs that I created on the left-hand side, that the wear is very linear over time in the beginning, but then it becomes very exponential as the dentin is exposed. So we want to stop this exponential growth or change over time. We want to keep the teeth very healthy and very safe till 100 plus. So we start off with our office by scanning. This is a digital scan. I showed you a picture of it with all the red before of my dad, or what it would have looked like for him. And this is Liliana scanning, and she actually is on faculty at Invisalign, and she teaches iTero internationally. So we have very skilled team players in our office, and I'm very proud of all of them. They take on a lot of continuing education. And especially in this COVID time, they're working and learning and learning and learning. So this scan, it takes maybe about 5 to 8 minutes, maybe even less. And we like to do this at each hygiene appointment, each new patient appointment. And then we can create a series of them over time to make sure that there isn't wear and tear on your teeth, or how are things, how is everything doing, so that we can make sure we can protect you in your very best and finest way. So after we scan, we have a conversation that follows. And today we have a different kind of iTero scanner that I was sharing with the professionals, and it's called the 5D. And it actually has infrared technology that allows us to detect decay even without X-rays, and then we can verify it with the X-rays, and we can also follow through. So the next slide here shows in a bigger view of, we take this circle and we put it along the arches, and the little white spot with the red arrow at the bottom shows where there has been some decalcification or decay. And then we have the intraoral photo, which is also a little bit of a red flag, seeing that darkness there, that tells us we've got a problem. So we can collect images like this and keep it in your file so that we can always review and know exactly what's going on for you. And this is called near infrared imaging. You will find that within our office, your file of images and X-rays and photos will be more than any other part of your body, and it's always available to you. So this is another picture of imaging. You can see that the reds are much, much thinner, or narrow, more point dots rather than big surface areas. So it's a much healthier mouth in the sense of wear and tear. And there's a lot more we can converse about it, but I just want to show you that we see many differences, including now we scan palates as well, because it's very important for me about airway and awareness. And here's one image from somebody else where you can see that the red is much more distinct on one side than the other side. So there's an imbalance in biting surfaces, and that's probably not the healthiest for us either. So we want to see the past, we want to shape the future for health and longevity. So major decisions in life are usually emotionally driven, but the most exciting part of dentistry is showing and seeing the impact of smile and face transformation. So we also utilize this technology called digital smile design. And this is a picture of one of my assistants who's very lovely, and her teeth were not in her representing her in her very best way. So we decided to take a photo, and we did a digital representation of where we would like her smile to be. We send it off. We get a template that we can utilize and place in her mouth with some special material. And then we remove that template, and we do very minimal contouring, and we say, do you like this smile rather than your other smile that you saw like 5 or 10 minutes previous? And this was her smile that she saw in 10 minutes. Now, it is only a mock-up. It isn't her final future result, but we wanted her to have that visualization. And she wore it throughout the day, and she was just smiling ear to ear, as you can see, and it's absolutely beautiful. And at the end of the day, she said to me, I'd like to just get this done now. And I said, you know what, you're young and your bite isn't ideal. So if I was to create this for you, I would have to take away a lot more to structure than I'd be comfortable with. So let's just hold off. Let's get your teeth aligned with Invisalign. And then I can do minimally invasive dentistry so that you can have almost all your natural teeth without having to sacrifice very much to create this beautiful smile for your lifetime. So this was a video that we took before and then after, just so that you can see, because with our records now for when we go into more advanced treatment for our clients, I like to, and I say patients and clients because to me, you're not a patient who comes and say, doctor, heal me. You're a patient who person that comes in and says, what can we do together to create the outcome? Because I only see you a couple of days a year, but you are going to be the one monitoring yourself over 363 days a year. And I may see you a little bit more, but as you get more controlled, I won't need to see you as much. So I need to know that you have the education and that we contract together to make a good change and stability and sustainability. So this is the video that we took of Banaz before and after, and she's happy to share this with you. Everything that I share with you, people have agreed in writing that they were comfortable in being able to share their experience so that you would be able to learn from them. And I have gratitude to them for that. But can you see how she is just showing herself so differently in her talk and her smile? There's so much more vitality. And when we create beautiful smiles, it just radiates. And in our world, we just don't see anything still. Everything is moving by us at all times. Our eyes are flickering and moving from image to image to image very quickly. So I feel it's such a much better representation of us seeing ourselves before and after rather than just a still shot. So let's listen to Annette because she decided to embark upon treatment planning that I felt was in her best interest. If I was in her shoes, this was what I would be doing. And that's how I talk to all my clients who come to see me. I just tell them what I would want if I didn't have the education and I was coming to visit a dentist. So this is what Annette tells us.
Hi, Annette. Hello. So I wanted you to just share with us a little bit about the treatment you've had here at Dr. Dana Colson and Associates and how it's impacted your world.
Sure. Initially, I came here to have my teeth cleaned and dental procedures or dental care done. And Dr. Colson had mentioned Invisalign. I had braces when I was younger. I have Invisalign in now. And I guess my teeth shifted over the years. And what I was noticing was that I was having trouble breathing, especially at night, because my tongue was pushed back into my mouth. And now, after only 17 weeks, the top palate has expanded and the bottom has moved so that my tongue actually can sort of rest on the top of my mouth. So I'm breathing better, I'm sleeping better. In addition, I've had a lot of tension in this side of the jaw for years and years and headaches. Yeah. And that's, I would say, 60% relieved.
Wow.
With no headaches.
And how far are you into your treatment?
My next appointment will be in 23, so I'm at 17 weeks. Next appointment's 23, and I think on the computer it said 30, and then they revise everything.
Okay. Nice.
So yeah.
You're more than halfway there?
I think I'm about halfway,
Yeah.
but the improvement is phenomenal.
Amazing.
Yeah.
Thank you so much for sharing.
Thank you.
So I'm going to go through some shared cases about chipped tooth, grinding, aesthetic appearance, crowding, airway, mouth breathing, and restorative, and the common benefits. So this is going to start off with Bob. He came in and said, "Can you fix my front tooth?" Now I've known Bob for about 20 years or more. He's wonderful. We don't have a lot of dentistry to do for him, so he's in and out. He gets good hygiene, and life carries on. We had him fill out his medical history, and he was pretty healthy. A few issues about snoring, and his dental history was all great. So this was his smile, and he said, "Can you fix my front tooth?" Because this happened just recently. And we said, "Oh, well," and normally I would say, "Oh, sure, come on, let's sit back, we'll get it done, and no problems. You don't have to have freezing, everything's going to be fine." But we started looking at this situation, and we realized that it wasn't just about repair, because if I was to repair, I would not be able to create a sustainable treatment for him on this. Because let's look further. These were his teeth. But do you see how that bottom tooth juts right up? Because that tooth had shifted so much, and through grinding and clenching, that it actually created a pressure point on that tooth, and then the piece that was left behind just chipped out. Because our teeth just don't close like this, but they go like this a lot. We bite into food, or we may grind our teeth a little bit, and this is the culprit. So do you see that if I added material on, it would just come off? We had the choice of doing a full crown for him, but honestly, to do a full crown on a single tooth, and I didn't want to incorporate other beautiful teeth to have a great result, it's just taking away tooth structure. And God, I can never create what God gave us to the best and finest. So I would, if it was for me, I would not say, "Oh, just do a crown." I would want to optimize the situation to have the most minimally invasive dentistry possible. So we presented the options to Bob. We showed him, because we did a digital scan, and we took some more records, and upon the records, I'm not sure if you can see by the molar, but there's kind of some darkness up the top on the top side, because there had been some grinding. So the gum tissue had actually moved away. And on the bottom at the back molars, the bigger teeth, again, the gum line had drifted down. It was darker down there. So it means that there was a lot of stress on those teeth. And the front teeth, you can see that it isn't pristine enamel. There's actually like a little line which shows that there's been wear away, exposing the dentin that we had talked about earlier, which is 6 to 10 times softer. So this was our digital scan, and you can see that, you know, there's a lot of red on one side, and the front teeth didn't have a lot of heavy pressures the way I showed you with my dad. But Bob, because he probably snored at night, he would grind his teeth a lot, and he would just be moving his teeth out, his jaw out, to try to get more oxygen for more breath, which is a good thing to do, but the teeth take the hit. So he decided to go ahead and be minimally invasive, and we created a ClinCheck. This is how we design the Invisalign retainers or aligners that we give you over a period of time. And this is what we created for him. So I'm showing this to dental professionals, but it's a way that we look at the top teeth, and we want to make sure they're leveled first on a specialized grid, and then from that point on we build the bottom to the top, so that we not only have a healthy smile and a functional smile, but it helps for your form and function and your physical well-being. Structural integrity is sustained. So, and you can see that that front tooth isn't fully down, but we're going to add on because we're missing that piece. Otherwise the gum line would be low on one side than the other side. And then when we do look at it from the front, this is what we project that we will be able to get when our clients wear the aligners, and then we'll have an easier way to be able to create a wonderful result. And then when you look from the side, you will see that that tooth that didn't have a fighting chance to keep a filling in place, all of a sudden we have created the space so that you would have a good chewing ability and that that filling had the opportunity of sustainability. So after we finished, we scanned again and we had a much more even smile, except that we still had more pressures on the left, which we have noted that when we see Bob again, we will contour those crowns. So because they were crowns, it wasn't the natural tooth formation, so that it will have less, more equal contact right and left without any damage to the enamel because those are existing crowns. So you can see at the top, prior to the Invisalign and bonding, those three images and how the teeth were interconnecting in the middle. To the bottom, where all of a sudden the arches were wide and broad compared to the top. You can see on the left-hand side that the lower teeth were now in good alignment. And also what we call the overbite overjet was in a much healthier spot. So they could bite into food. And this was the finished result after we'd done the bonding. It's basically invisible. We have the technology available and the materials that we can create invisible bondings. They're beautiful. And we did a little bit of extra on the sides of what we call the laterals. And this is kind of where we got to him. So his wellness benefits, well, by doing the Invisalign and restorative for Bob, we got to preserve his tooth structure. Not a lot of preparation, not a crown where we had to worry about coloring, and me being at the mercy of my lab, as wonderful as they are, like that's such a tough job to do. We align the teeth to have an ideal, what we call envelope, a function of chewing in. We align the mandibular incisors, the bottom teeth, to their ideal position. We created a healthier smile congruent to his face, a more optimistic smile and display of vitality, and happiness creates endorphins, which is our best natural vitamin. So let's see what Bob had to say about all this.
So Bob, how do you feel about your smile now?
I love it. It's my desire is always to be the best I can be, and that's mentally, physically, emotionally, spiritually, and the results are just they're fabulous. Your sense of well-being is improved, and just your ability to enjoy life just a little bit more is there.
Sweet, eh? Such a great person. So I started studying about airway and how the mouth affects our body with if we don't have enough oxygen intake because we have crowded teeth or our tongue is in the improper position or our palate is high. And it's been a passion of mine ever since, and I structure really all of my work when I get to do optimal quality dentistry the way I would like to for all my patients, to make sure that we can breathe through our mouth rather than our nose. But at the time that I had taken this education, this People magazine came out in 2008. And there's a picture of Tim Russert, who was a journalist. And you can see that what they said is that he lived for 58 years. He was a family's heartbreak. And when I looked at that picture, I automatically knew that if we had known then what we know today, we could have treated him so differently. He was suffering from a very narrow arch. We can see that he has dark hallways at the sides of his teeth here. He has dark circles under his eyes. He has a neck size greater than 17 inches. And he has very chubby cheeks, which means he was grinding and clenching all the time, wearing down his teeth, probably to get airway. And if you can't breathe well at night and you don't get full oxygenation, you can cause stress in your heart. You can actually die in your sleep. I don't want to make you fearful that you're going to die in your sleep, but anybody who mouth breathes and snores needs to be checked out to see, are we depriving ourselves of oxygen saturation in our body? We need it for all of our body functions. And if we deal with obstructive sleep apnea, we can take 8 years off of our life. And so many of our other systems get challenged that today nobody has to have that. Sleep studies will tell us if you're mild, moderate, and severe, and the gold standard for mild to moderate is actually having a dental appliance or us working to optimize things for you. And I'm going to show you a couple of cases that relate to that. So for me, it's strong foundations, but it's because it will optimize our airway and minimize sleep apnea by widening and uprighting our teeth. So first, the airway. We want to look at, we also want to make sure that my clients are breathing through their nose, they have quiet sleeps, they have good tongue posture, and often when our jaw is in the best position and our breathing is in the best way, our whole body posture benefits too. So it isn't just what we would do in dentistry, but it's what you can do for yourself at home. And one of the ways I strongly suggest is looking into the Buteyko breathing method. They have many books about different ways of breathing for many different symptoms, and they even have one for children. So I encourage you to look at that. We actually have a new program starting in our office called Healthy Start for kids 2 years and older if they have sleep problems. We have a sleep questionnaire. Please ask us for us. We'll send it to you. Fill it out, send it back. We'll have a conversation. And there's an amazing way that we can now help children have the best quality sleep. We don't have to wait until they get to be 8 years older to start treating them. We can deal with it sooner and give them quality years for their growth and development to be the healthiest version of themselves. So let's look at this palette. This is one of those digital scans, and we put it on the screen, and I just moved the image to see how high up does this palette go. Well, this palette goes up twice the height that I would like to see. And this belongs to my friend Hamid. And Hamid has been incredibly generous in sharing this journey. And I met him as a new patient. He shared his story, and afterwards I was so inspired by him that I asked that if he would do a quick video, and he's agreed. And this is the first of a few videos that he's done with me. But listen to Hamid, please.
So hi, Hamid.
Hi.
This is our first time meeting, and you gave me a very inspiring story. And I just like to share it with others because I do know it's possible, and you've just proven to me it is possible.
Yeah.
So you went to an orthodontist, and they told you they needed to take out 8 teeth and reset your jaw, and that wasn't comfortable for you. But they also knew that you were a mouth breather, and that wasn't good for you because your mouth was dry in the morning and perhaps not getting as good quality sleep.
Yeah.
So you decided that you would go onto the YouTube videos and you would then just practice and learn how to do it. Can you describe to me what you did?
Yeah, so I was disappointed by the consultation because they said to get a jaw surgery, and that would take a long time to recover from. But I knew that I wasn't practicing good oral posture. So I went to like YouTube or Google, searched, found some videos that explained where to put the tongue. So I found a video that said to put the tongue in the upper palate and to close the teeth together and your lips. And so ever since I've been practicing that, it's been like 8 months, and I see lots of improvement in the expansion. My face is more wider, and also my cheeks are not flat anymore. They're improving.
And what happens when you wake up in the morning?
So when I wake up, there is no dryness in the mouth. Before I would have dryness, my mouth would be dry, but...
Right. And your lips are together in the morning, you notice that as well?
Yeah, like when I wake up. I mean, I've been practicing it throughout the day, so...
Yeah, it becomes a...
It's like how I have it.
Yeah. Good work.
Thank
Congratulations.
You. Thank you.
I'm all for it.
So this is Hamid's mouth. Can you imagine? It's so hard for his tongue to rest comfortably at the top of the inside of his top teeth because of the height and narrowness of his arch. Now, what Hamid didn't mention was that he was so determined to do this because the oral surgeon not only said surgery, but he also told him he was going to extract 8 teeth. We decided to do this without extracting any teeth. And I'm going to show you those pictures. But one of the things that Hamid was determined to do was he found an app on his phone where his phone would vibrate every 10 minutes, reminding him, tongue up in the roof of mouth, tongue up in the roof of mouth. And he practiced that. So when he saw me, this would be his bottom teeth. And when we look at this, I'm showing you pictures of top and bottom teeth 1 week apart. Now, why would I do that? Well, he decided he wanted to undergo the treatment that I suggested, which was Invisalign, because I believed we could do this. Most people would say, oh, Invisalign will only move a few teeth, but my experience has been different. And when we took can you see on the right-hand side, the pictures of his bottom teeth? Can you see the difference? The bottom one shows the top surface of his tongue, but the top picture shows the floor of his mouth, because whenever Hamid would open his mouth, and I'd say open wide, his tongue would automatically go to his palate. I had never seen that before in like all these years that I've been doing dentistry, but he's just so inspirational to me because he has allowed better health for himself by breathing 100% oxygen through the nose rather than 80% through the mouth. And one of the things I didn't mention is if you breathe 100% oxygen through the nose, then you get to produce what's called nitric oxide, because in our nose we have all these little coils, and they end up kind of filtering the oxygen so that it breaks it down to nitric oxide, which is very important as a primary source for new cells and new health and development. So this was Hamid 18 months later on the bottom, and can you see, like, that's a totally different mouth, right? No extractions, it was just by widening and broadening. We did a couple of other adjunct procedures to help move this along. It was through what's called Propel, which, and then also VPro 5. So one is a microosseous modification that we would do in office, and the other one was a home device that you would put in for 5 minutes a day with the liners in, and it would just create a small vibration to help move these teeth even further. There was no gum recession or any periodontal problems related to this, which in the past, most dentists would say, no, 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 you can't do this, you can't do this, you're gonna cause problems, but we track them very carefully, and there were no changes. So we have gotten him to the point where he's his teeth are a little bit wider than we want. Now it's time for us to bring it in for beautiful facial harmony. We've created the width. Now it's just about bringing the teeth into their best place. But this is a photo of him now, and we're going to next year, we're going to optimize everything to a wonderful result for the balance of his life. So talking about airway, the yellow represents the airway that we have challenges with when we cannot have our tongue in the proper posture. And sometimes also when the jaw is too far pushed back with deep bite, sort of like my dad, but we really want the jaw to be forward and to have that freedom so it doesn't cause pressure on the jaw as well. And there's a myriad of other situations that occur that we won't get into today. I'm sharing so much with you as it is that I want you to, we'll focus on this part. So we would take what's called a supplementary X-ray, and this shows a really beautiful wide open airway. You can see that behind the teeth, there's a big kind of line of darkness that shows that there's lots of room for airway. And now I'm going to share you about the case of Jeffrey. So Jeffrey started wearing Invisalign, and people would say, well, why are you wearing these? And Jeffrey would say, well, my mother said this may help. Because you see, Jeffrey had mild apnea, loud snoring, and a narrow airway. So who is his mother? Well, his mother happens to be me. Jeffrey's my firstborn, and I have 2 children. And Jeffrey started snoring when he had. And the reason why I found out about it was his friend said to me, Dina, do you know that Jeffrey really snores really loud? And I said, no, I had no idea. And of course, we don't know that we ourselves snore, but there is an app that you can get on your cell phone, and it says Snore Lab. And you put your phone on airplane mode, put it under your pillow, and you go to sleep. And in the morning, you can see the spikes. So we can monitor ourselves even if we are on our own. And I think it's very, very valuable for us all to be aware of what really goes on. But one day I did hear Jeffrey snore, and it was so loud that the walls literally shook. And I said, oh my God, what am I going to do? And, you know, as a mother and having a 25-year-old, it's kind of out of my control. I didn't know, but I did learn a lot about sleep and dentistry. And I thought, well, let's just get the knowledge into application and let's see what can happen. Because honestly, I would not think, I don't believe that a young adult male would wear this. So I knew that would not be an option, nor would I personally ever want that for myself if I didn't have to. And this is the CPAP, bringing pure oxygen in, which is fantastic because it means we get oxygen into our system and allows us to sleep better. And there are so many important functions. But the reality is there isn't a huge compliance in this world for CPAPs, but it is a start. And if your doctor recommends because you have severe, yes, do it. And then over time, perhaps there are ways that we can optimize it so that perhaps CPAP won't be your mate for life. But definitely for Jeffrey at 25, I know this was definitely not an option. So here he was at 10 years of age. He had a very deep bite. I did what we call a sagittal appliance. It was like a little plastic screw, like in some acrylic, and we expanded that, and then we did traditional orthodontics. And but then at 25 years old, this is where he was at, and everyone would say, "Oh, you got a great smile." And you know, I did the very best I knew at that time. But this photo was taken 11 years ago, and this was when I was heard that he had very, very loud snoring. So at 25 years, this is what he looked like. And so I said, Jeffrey, let's do Invisalign. Let's see, I think it can help. So we did the digital scan and we submitted it into iTero. But all of a sudden I looked and I said, oh my goodness, look at this one eye tooth where that black arrow is. That is so much shorter than the opposite side symmetry. And like, this shouldn't be worn down like this at your age. Like, oh my goodness, what's going to happen when you get older? So we took that into account when we ended up modifying. But what was very important to me was that we could expand between his molars from 36 millimeters to 40 millimeters. Now you say 4 millimeters, what is that going to do? Well, when we started exploring, we looked at the photos, we could actually see, and until we actually do these kind of records, we really, even as a dentist, I didn't see this in my son's mouth, but you could see that the right side was lower than his left side, and it was kind of a wonky plane of what we call occlusion. And you can see that shorter tooth on the left side than the right side. And afterwards, that's what it looked like. Now you see these little white bumps because we weren't fully finished in doing Invisalign, but we were close to the end. But they were actually helping move the teeth into their optimum position, and there's no tooth takeaway for that. So when we look at the side by side, you can see the big difference, how everything became leveled for Jeffrey. And we widened out and we had some of the lower molars, instead of being so far tipped, much more upright. So we had a machine that was called a pharyngometer, and we had him breathe in and out. So in is the higher line, out was the lower line, and you could see the lower line was below that darker horizontal line that I have marked on the graph. But afterwards, look at the difference. Everything was at that 2 level, which means when he inhaled and exhaled, there wasn't a collapse of his airway where he had to gasp for air. It was a smooth breathing in and out, and the airway was large enough that it could help. So when we look at his Supplementary X-Ray, I took one afterwards to compare, you can see where that black arrow is that the tongue actually had the chance to move forward, which opened up that airway for him. So I decided to do a little bit of basic math, and I decided I would measure some strategic landmarks that we do in dentistry. So I put X's 2, 2, 3, 3, and the after ended up being 3, 4, 4, 4. At this point, after we had expanded, he had no more apnea. He had no snoring. He purred like a kitten at the most. Just by widening his archways, we were able to open his airway. And then I decided I would do the pi r squared for the area. And with a 33.3% with increase, we increased the airway by 100% for him. So this was a huge gift, by modifying his occlusion or his bite, we were able to preserve tooth structure. We leveled his maxillary plane, the upper teeth, for structural integrity congruent to his face. It allowed him to have better night's sleep, minimal snoring, better oxygen uptake, and resetting of the hormonal body systems. That's what happens for us at night when we sleep. That's a byproduct. Our body gets to restore itself. And when we have better quality sleep, we get to have better memory retention, a big bonus for school and our lives. But most importantly for Jeffrey, the CPAP will not be his nighttime life partner. So studies show that the normal amount of wear on teeth is 0.01 millimeter per year, which means in 100 years, we should only lose 1 millimeter of tooth structure, which is incredible, and we seldom see it. But we do have some patients who do have that kind of wear pattern. So minimal, and like we just rejoice knowing that this person isn't different than anybody else, except that they had the good fortune of having teeth aligned in their very best interest. So this was a 30-year-old chiropractor that came to see me, and this was about 20 years ago. So what happened here? Look at all the wear on those teeth. Oh my goodness, such a relaxed person, but when we looked inside, this is what we saw. So working with the laser for a long time, since 1990, I've been able to restore these teeth with minimum tooth reduction, and we micro-etch the surfaces and we fill in these areas, and I fix them and I said, good, you're good to go. But when I was reviewing these photos, I realized, oh my God, at that time I wasn't even looking. Look at the receding gum tissue. What could we do? Well, traditionally it would be have a gum graft. But he moved away, so I never got to have that conversation with him, and his teeth were crowded, but I never even thought about telling him to align it. Just like, I just didn't realize what the future would be for any of us or how it would play out from what and nor did I have the technology I have today and knowledge. It was, those days it was fill the teeth and, you know, no decay and keep the gums healthy, but now we know so much more. So it's all about education and awareness. And it's all about the force. We don't want abrasions. We don't want breakage. We don't want receded gum tissues. We don't want teeth movement. And we don't want wear at the gum tissue, like notches, dental terminology. So I mentioned that sometimes we can do time lapse with the scan. And this is one of the examples of someone who we took the teeth that were inward and we uprighted them like that, and the gum tissue which had worn away, and we had gotten those notchings at the gum tissue. And then after we aligned these teeth and we did a time lapse, this is what we saw. Look quickly because it happens quickly. Do you see how that gum tissue came down? Let me see if I can repeat that for us one more time. Whoops, sorry. When it comes down, that's the later date that happened. So that shows that in 2019, the gum tissues were actually lower because the teeth were in best place. Because teeth move as a unit. They're just not individual movements. So this is a picture of a scalloped tongue, and I always look for this when I do my intraoral exams for my patients on recalls or new patient exams. And if I see this, it's a sign that we're clenching or grinding our teeth. But it's so insidious we don't even know it. It's like Canadians saying A at the end of the sentence. We're not even aware we say it until someone tells us, and then we're aware. So in Chinese medicine, they would say that we have some body organ issues. And I've also discovered that this is a direct sign that our teeth are interconnecting, because when our teeth are clenched together, our tongue ends up kind of balancing between, because that needs to stabilize this little bone called the hyoid bone, because our tongue is only attached by this little bone in here, whereas every other muscle in our body has 2 anchors, but the tongue is only 1 anchor. So when we clench our teeth, the tongue anchors against that and creates the imprints. I tell people, if you sleep on a corduroy couch, you're going to get markings. And similarly, if you clench your teeth, you're going to get these little pinch marks too. So it is a sign of grinding and clenching, which is very destructive to our teeth. So teeth should never touch, ever. And that's what I always tell all my patients. And I want to keep reminding them, because it's something that we just need to hear over and over again. I used to grind and clench my teeth, so I am very cognizant of it. That's why I went into Invisalign. My teeth were not crowded. I had too much pressure on my front teeth and I was wearing them down, and I didn't want extensive crown and bridge. And so I did Invisalign, and now at night I always wear a bite plate to protect myself because I just want to preserve everything the way they are. So it's always lips together, teeth apart, not touching ever, and tongue in place. And tongue in place means behind or front top teeth. And I often will share this analogy. If two vertebrae were touching, would you be in pain? And people say yes, because we're compressing our blood vessels and nerves, and therefore we have terrible back pain. But God created teeth stronger than bone, so we're lucky that way. It's 5 times stronger. But the strength is for us to chew our food, but not to do this or this. It's always lips together, teeth apart, all the time. So it's a mantra. I need people to, when they do become aware, they grind and clench, that it's lips together, teeth apart, lips together, teeth apart, 100,000 times a day until we start breaking that habit. And we show muscle releasing exercises and other techniques so that you can make sure that there's not tension in the muscles. So it's not just what I can do for you, but what you can do for yourself as well. And we coach you on that, and we want you to have the stability and longevity. So how are we going to eliminate these forces, with a night guard or alignment? Because Invisalign is not just a piece of plastic. It has biometrics with a huge amount of information that is encoded into each aligner. They're removable and gentle. There's no metals. They're invisible. They're comfortable, and a great way to reset the stage. And for me, I just want to remind you, I don't do Invisalign just for the good looks. It's for form and function, for your longevity of everything that works as a unit of how the mouth integrates with your whole body. So let's look at Gordon. Gordon says, it's time to fix my teeth. A lot of people enjoyed this part of the lecture most, so I hope that you're sticking with me, and we have 3 cases to share before the end. Gordon had severe wear after 8 years. After his first visit with me, he was fearful of dental offices, yet incredibly friendly. He had erosion, wear, and parafunction. So this is what Gordon looked like in 2009. He had a really nice, charming smile. But when we look closely, we saw that there was a lot of wear on the teeth. You can see like lots of darkness around the gum line and a lot of wear on especially the right-hand side of the screen. Well, it's the left-hand side of the screen, but the right-hand side of the mouth. So I'm sorry if I confuse you. Dentists always look at things different. And this was what he looked like from the top. You can see there's wear on that one side more than the other side. And on the bottom, again, a lot of wear on those front teeth, exposing the dentin that we talked about, 6 to 10 times wear. And look at the back teeth, how there's that yellow. Again, he lost the enamel. And there's some residual fillings left behind because they wore slower than the tooth enamel. And this was his X-rays that showed we had lots of beautiful bone, and his supplementary X-ray because we were choosing to do more extensive work in 2009. And this was from X-rays, what's called tomography of his jaw joint. And you can see that second picture down, one side looks very different than the other side. So one jaw joint was getting more and more than the other, very asymmetrical. And this is what Gordon looked like when he came back to see me in 2017. He said, I need to fix my teeth because although he was incredibly healthy, his teeth had worn and they were no longer comfortable for him. So here's a picture of Gordon smiling, which looks great. I mean, not much different from before. However, when he opened up and we looked more closely, we had a lot of wear on his on the left side of the screen. And when we looked further, we could see that the front teeth had actually moved. I'm going to compare with you later. And on the bottom there you can see, and I put black arrows, how those teeth had actually moved over 8 years. And yet he had really strong bone formation. And I never believed that teeth would move unless we had lack of bone. But the force changed that. And then on the bottom, look at these molars. No wonder they were sore and sensitive for him. They needed help, and they needed help quickly. Look at all of the wear on the sides of those bottom teeth. So I think that probably some of this could have been from Gerd, and the Gerd is really serious in the sense that it's gastro regurgitation from the stomach, fluids into the mouth, and it's very, very acidic, and it often happens at night. And 40% of us don't even realize we have that happening. But if we do, it's so acidic that it can sometimes cause esophageal cancer. So we always need to check it out to make sure that that's not happening and to talk it over with our doctor. But look at all the wear on these teeth. We have no more enamel. And this tooth got just so worn down that we decided to do an elective root canal to save that tooth for now until we decided how we were going to create the future. He'd already had some other root canals. He was fine for that. And so that was the choice of action. A lot of people think root canals aren't healthy, but I want to just remind you that it is for some people and not for other people. My father at the age of, died at the age of 98, and he had a root canal since the age of 12, and it never bothered him. So he got to preserve that tooth. So when we look at the photos before and after, you can just see comparatively with your eyes all the wear on those bottom teeth at the sides and at the back, even more so fast. So in dental terminology, we'd say we had severe erosion, attrition, and parafunction, which meant there was a lot of grinding and clenching. And so we gave him a little bite plate to wear at night just to see where does the jaw really want to sit, because it just gotten itself out of control. It just didn't know where it should be. And if I was going to restore this case, I needed a predictable position that was true for Gordon, his true north of how his jaw really wanted to sit, rather than where it was accommodating, where its true posture was going to be. So when we look at his teeth weren't even touching. And I think that's because they were so sore, his jaw just wanted to move forward. And you can even see that the midlines were off in that middle picture. You can see that the front of middle teeth and the bottom teeth were not congruent. But when we finished with the deprogrammer, we found that the midlines did line up. And this was our digital scan. After we had done some crowns on his top and bottom teeth just to get him back to where it was, to protect him so he could be comfortable. But on the bottom, he also wanted bottom crowns. He wanted the very best, and he said, I want to pay for this, and I want you to give me what I need. But you can see that the bottom tooth was a little crowded there. It was a little twisted. So if I was to create a crown, I'd have to reduce some tooth structures so that I could have room to have a nice tooth placed in there. But there wasn't enough room for me to cosmetically make that change. And it would also be very deleterious to the health of that tooth, because I'd have to remove so much tooth structure that I really did not want to. So at this point, we undertook the use of doing Invisalign. And you could see at the top, that was before we did anything, and at the bottom, this is after we did Invisalign. We moved those teeth just a little bit in the front in ways that it's hard to see right here, but he had crowns in his back teeth so that he had proper chewing function. And then that was the before and after. At the bottom, when you could see that that bottom tooth was much more aligned compared to being twisted, and that these teeth actually had strong porcelain coverage, zirconia coverage, which would give him stability and ability to eat and chew his foods. So this was before any dental work, and this was after the dental work in the back, after Invisalign, but not before the final crowns. So you can see that the midline shifted. I know it's a lot to take in. My eyes are so trained to it, and for you, like, oh, I hope this isn't too much information. But all of a sudden, we could see in that bite plate over that period of time that Gordon actually created a notch. So his grinding and clenching isn't just because of the erosions, but it was probably hardwired in the brain. And I had to protect him. For him to spend all that time and energy, and for our time and energy, I don't want to ever redo work. I just want him to stay stable, and I want to celebrate in the success that we get for him. So he understands that this is something that we're going to have to protect for him for a lifetime. And that's by a bite plate and retainers, different modalities. But again, we created, and this is what I showed to the healthcare practitioners that were watching last week, that this was how we were moving the teeth into a better plane where he could become level, 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 and that we wouldn't have to reduce a lot of tooth structure. And then when you look at how the teeth were looking after we optimized his bite in the back, we then moved the front teeth into their very position, and you can see the midlines were nicely matched and everything looked so much better. And then from the side, again, we created that proper, what we call envelope of function, how the bottom teeth could come in and chew the food properly rather than hitting, or not having proper bite force. So this was the result after the Invisalign. And you can then, the very bottom picture on your right shows the teeth restored with beautiful crowns. So you can see how before was when Gordon came in after the Invisalign, and then how we could restore minimally invasive without a lot of tooth takeaway. And this was his overbite over jet, which looks great. And this was his full smile. So that was the difference. Isn't that amazing? I just get so excited. This is what drives me to love to learn and to be able to make significant changes for people for the quality of their life. Gordon looked 10 years younger than he did in 2009. And really when you consider 2019, that is really almost 20 years younger. I think he looks just great. His haircut's just a little shorter. So what were the benefits? Wellness benefits of Invisalign restorative beyond just having his mouth healthy? Well, we got to preserve tooth structure, yes. We found a true centric, a true position of where his jaw really wanted to sit and aligned his midlines. We created comfortable teeth for him to chew his food. We aligned the bottom teeth to their ideal position so they weren't crowded but aligned. We preserved more tooth structure again for that finish. It was a healthier smile congruent to his face. A more optimistic smile and display of vitality that you could see, because happiness creates endorphins. It's our very best antioxidant and natural vitamin. And his wife loves looking at his smile. So that's a huge bonus for both of them. So let's go on to Mary. Mary says, my teeth are not comfortable. She's beautiful inside and out. She's 54 years old. I'm so grateful that both her and Gordon would share with us like this. She's a chartered accountant. She looked after herself incredibly well. She had good health, lots of supplements, but she wasn't happy with her teeth and her bite. It wasn't her fault. It was just the way they were situated. And we have a wellness sheet, and you could see that where she saw herself and where she wanted to be was the opposite end of the scale. So here's Mary. You can see her teeth are very crowded on the top. It's a guarded smile. This was her profile. These were her teeth. You can see there's notching and tetracycline staining when she was younger. They didn't realize when she was younger, when they gave her tetracycline for an infection, that it would stain the teeth, but this was the result of it. And today we can actually whiten teeth if they are in the ideal position from tetracycline staining, which is a big bonus. But you can see that right now her teeth were kind of inward and there was a very deep bite. Lots of pressure. She kept her teeth incredibly well. But you can see all that incredible wear on those bottom teeth. And she wanted to have a beautiful smile. Those teeth needed more restoration than just a little filling on the surface, because we lost the walls of the tooth on both sides. And there was a big space on the side. So how was I going to fill in that space? I don't want to put 5 teeth or 4 teeth, and it just didn't make sense. We needed to balance it all out. So we looked at it all, and we started like Gordon. We gave Mary a Coy's daytime deprogrammer, and she wore that to make sure her jaw was comfortable, because she had jaw problems, and we wanted to make sure that she was totally comfortable before we proceeded, because remember that extreme wear that she had would only become exponential over time, and she was aware of that, and it was way before her time to have all this wear. And really the way the teeth were aligned, it was like a house that was not being supported properly, and it was all because there were signs of foundation failure. So we took X-rays, and it showed that we had lots of bone, and we took molds of her teeth. We articulated on a special articulator. This was called Panadent that I learned from my COI studies. And we looked at how the upper arch was really sitting. Was it level? Was it irregular? And we decided that it would be best if we could, did a digital scan as well and examined that. And you could see the little orange red dots on the front of how those teeth were just grinding out. Whenever she moved her jaw, the top teeth were holding her bottom teeth back, which created more pressure and pain on her jaw joint. So we knew we had to get these teeth out of the way. We could have done it with crown and bridge, but it would have meant that we've had to reduce a lot of tooth structure unnecessarily. We want to keep things optimized. So we made the decision that we would do Invisalign full, which meant like a full case, and then we would do the crown and bridge to follow. So we had a very deep bite, and we shifted those teeth over, and at the bottom right-hand picture, you can see how those teeth were better aligned, and we aligned her upper a little bit so that everything was more level, which is very important for our whole structural integrity. And then this is why I say to the professionals, okay, let's talk about a virtual FaceBow, and this is how we design it on the Invisalign ClinCheck that we do for our patients. So we take the upper teeth, and we want to make sure it's level, and that what we see on these ClinChecks are equivalent to what we would see in the mouth through our photos. And then we design it so that these teeth can come down a little bit. These red marks are little attachments that we put on. They're just the same to color of our teeth, so that the aligner has the ability to move these teeth a little bit more. And the blue marks are what we call power ridges, just to help the teeth get into a better place. And then on the bottom, you could see how we shifted all those teeth so that they were much more congruent, and then we could restore it in a very much more beautiful way and minimally invasive. So we got on a simulation that the teeth could go from this position to this position, and then I would have the opportunity that I could create a wonderful result for Mary. So this was after Invisalign. You can see how the bottom teeth are much more aligned, and this was after the Invisalign at the top to the full reconstruction on the bottom. And in the middle, you could just see how her smile was just much more relaxed and very beautiful. And it was all, again, we saw that in Mary's case, she made a notch in that bite plate, which meant that she was clenching her teeth still, and that during the daytime. And so it's a habit to learn and to be aware of, and we coach her through it so that we can have stability. So this was her picture before and after, her profile, which is so beautiful. And look how gorgeous she is, and like 10 years younger, at least, right? And much more wide, not a guarded smile, and she shines. So what were the wellness benefits of Invisalign and restorative for Mary? Minimally invasive, well, we leveled the upper teeth with the use of the grid. We decreased the wear of the on the bottom teeth. We matched our midlines with the jaws so that it was comfortable, and that we could, as a dentist, manipulate, which is very important to get the stability that we need. We have a more vibrant smile, youthful mouth, minimally invasive dentistry with less tooth takeaway, a better profile by restoring lost vertical, age reversal was plus 10 years, and we allowed the beauty that was inside reflect outside through her beautiful smile. She's amazing. So this is our final case, and this is Obi. And Obi actually came to bring his daughter to me to say, how can you fix my daughter's teeth? They're crowded. And I suggested that we could do Invisalign, but for whatever reason, his daughter decided that she wanted to do braces. And while I was in the conversation with Obi, I said to him, when he was with his daughter, I said, if you ever want to talk about your smile, I'd really love to talk to you about options. And a few months later, Obi came to see me as a new patient because he was definitely friendly. You'll see, I have a little video. He was an executive, but he had a malformed front tooth, and his front teeth were what we call proclined. They were jutting out a little bit. So this is the picture of Obi. And you can see that there isn't symmetry between his two front teeth, and his medical history was good, but he didn't have a great experience with dentistry in the past, and his smile characteristics he was not happy with either. So this is his profile, And this is what his front teeth look like. And you can see that that tooth is really screwed to the side, and it wasn't like in its, I just like, even when I was looking at it, like, okay, how am I going to do this? I can't just fill in that gap. That's going to be 2 huge teeth. And this isn't a good profile the way I'd like it for stability. And when he closed his teeth, you could see the heavy, heavy pressure, which didn't work as well. And you could see that on the profile, those teeth were just pushing those teeth, which you've learned from me today. The teeth need to be apart to bite into food, but not to be pushing all the time, which isn't good for stability. And when we look inside, this is what we see. And so that tooth had a root canal. That's why it was dark. It wasn't bothering him. It was healthy. He was in good health. So we decided that in order to move that tooth, we needed to create a tooth that was a little bit more ideal, because eventually that tooth would have a crown on it. So we created a temporary crown, which allowed us then to do Invisalign to move the tooth to the optimal position. And by doing that, we could then move that tooth into its optimal position. It would be a little bit more surface area for the aligners to be able to engage in. And this is OB afterwards, which is already looking better, but that's not the way our outcome ended up being, which you will see in a few minutes. So this again, we had the clean check, which we did on the grid to make sure that we could create a very level platform, which is very, very important for me. It's all about form and foundation. And this is what you see from the side. And again, we can see that the teeth move into their best and finest position. And at this point in time, then we could restore the side teeth that were just a little mal-shaped. And you can see the profile, the great changes that would occur. And here you can see now how the teeth were better aligned. And this is with the temporary in place still, but after the Invisalign, so it's a much different smile. And so we took him from the top where he was originally seeing me to with the temporary crown to the final after Invisalign, but before the bonding. And we did some whitening with him as well. And this is the result, the bottom picture of what we got for the overbite overjet compared to where he was. So he much better opportunity to bite into food. And again, you can see how the teeth have a much better proclination or alignment rather than being pushed out, much more healthy. This was with this new Emax crown. It's a pure porcelain style, no metals. And look at his smile and profile now. And this is his smile. And this was probably 6 months or a year after we treated him. He came in and we were doing a minor procedure, and I asked him how it was going. He said he had a new job. He shared with me, and I said, can you do a video with us, please? So he's so gracious that I'm going to share that with you in a minute. So that was the before at the top, and this was the bottom. In the middle shows with just the temporary crown, the change, and then the final result. So the wellness benefits for OB of the Invisalign restorative was, again, we were able to align his front teeth. Otherwise, so that we could create an improved profile, and we enabled longevity of the teeth. We created an award-winning smile, an increase in self-confidence to attain a preferred future. We enhanced his the happiness factor, spontaneous increased sustained smiles, because we know we increase the endorphin release the more you smile for health benefits throughout our body. Best natural vitamin. So here's Obi.
Good job, congratulations.
Thank you.
So I asked, how did your smile impact on feeling that your smile helped you get your new job?
Well, one of the things I was worried about in knowing that my contract was ending after a long time is how I would appear in an interview for the first time for many, many years. And
when the dentistry work was done, before that happened, I was really happy about that because to me it meant that I didn't have to worry about appearing self-conscious in an interview. I could engage the person interviewing me. I wouldn't have to feel I would look away if I was going to smile. And so that was just one less thing to worry about. It was great.
So congratulations, you look awesome.
Thank you.
My endorphins go because I look at them and smile, get increased. So this is the story about 4 of the people, including Hamid. Well, Hamid and Jeffrey was about Airway, but how we worked with Invisalign for these people. I want to say thank you to each and every one of you. You're allowing your story to be shared to help other people understand that dentistry can be kind, non-invasive, and it took less than 18 months to accomplish these smiles. Invisalign enabled us to create minimally invasive dentistry, and I have so much gratitude to be able to be part of these changes and to be able to share them, because this is what drives me in dentistry, is to know that we can be kinder and more gentler and enhance the quality of life for us. And who knows what our future is going to bring, but we only want to optimize everything that we possibly can. So we're going to finish by a little video by Bob.
It's quite nice to see.
It really is.
Okay, so Bob, if someone told you you were too old or why do this now, what would you say to them?
I would say that if the person I'm speaking with wants to be the best they can be, that's partly physical. It's the aesthetics of a smile. It's feeling good about yourself. And I would say, do it now.
So that's the end of this sharing. I know that many of my clients who come to see me have my book. It's a yoga-based approach to explore the interconnectivity between oral health, whole body wellness, and longevity. It's in its 2nd edition. If anybody would like to have an ebook, I'm more than happy to send it to anybody. We do sell them at our office. Remember, beautiful smiles with straight teeth are no doubt important, but health and well-being are life-changing. That's how I look at dentistry, and that's the kind of service I provide. It's all about materials and biocompatibility and awareness and education, sharing with you. If you have any questions, you're more than welcome to email us at the same address. These days in COVID and for a while post-COVID anyways, we will be doing most of our communications by this methodology, by Zoom or FaceTime. And then when you come into our office, unfortunately, we'll be masked and gowned and shields, and oh my goodness, dentistry takes on a different look. So I think this is the best way for us to communicate. I'm more than happy to explore and share with you. I really want to optimize anything and everything that we can do for you. Any questions, don't hesitate to reach out to us. Thank you for your time. It's been a pleasure to be with you. Bye.